guthie egucio ringi nigetha wimbo uyu uroka have ino iragia mwena uyu itige agie na mugongo uhana ta witu ugutwika straight, hip yake tige kuimba mwena umwe nigetha ahote guikara na ahote guthaka tondu tariu kuria gwake ni kuritu kuhota guthaka ta na twana turia tungi ndangithaka ihinda inene nigetha acoke maisha make nomo. This is her back at this point. No yathondekwo ni gucoka uria yagirire.
At night I can't sleep the way you sleep. I sleep different. I can turn this side, and even the back. And when I eat, I don't eat that much. When I eat, my stomach will hurt so much. I feel so pain when I can't sleep.
Ungirora ni ukuona Nicolina haha ni aroneka he handu atemetwo. Haha niho akoretwo akihingurwo maita macio athiete. Ria mbere cuma yaingiriirio rugongo na ria ingi kienda ikihingirwo gatagati. No maita maria macio mangi meri egucitio ehingirwo ha gatagati.
I want to invite you in to welcome you in, and of course I've said your name. You tell us your name. Tell us a little bit about yourself, and then we proceed.
My name is Nicolina Njeri. I'm a mother of 2 daughters, Nicoletta Mudhoni and Nicolina Njeri. Thank you for inviting me to your channel. I have a story which I can write a book about. I'll give more of my second born daughter, who is Nicolina, ambaye alizaliwa na health challenges. And to start with, I'll say this. It's a dream of every mother to get a healthy baby or to give birth to a healthy baby. But unfortunately, when it happens the other way, that is why most of the time utapata watoto walitupwa, mtu alifika hospitalini kuangaliliwa mtoto, akaambiwa mtoto ako na shida, akamwacha. Never blame them. It once happened to me, but instead of leaving my baby, I decided to board and be close to my baby. Nicolina, who is my second born daughter, alizaliwa akiwa na shida ya roho, ambayo ilikuwa na shida bado ya spine, akakuwa na shida ya kukula. As every mother knows, ukipata mtoto, there are those milestones that after giving birth, you're waiting for your baby to sit down, you're waiting for your baby to crawl, you're waiting for your baby to stand and feed well. Unfortunate to my daughter's case.
We talk about Wellness Monday. We talk about my story. And this we do, and we do to stand and to walk with our own, because I'll always say there's no convoy of one vehicle. And so, the story of Nicolina Njeri is a story that you don't want to miss, but a story that you can't afford not to walk with Nicolina, to see her smile. Mama Nicolina.
Yes, Daniel.
Karibu tena.
Asante.
Kindly tell us about Nicolina.
Nicolina was born on 2012. She was not termed to be born. So it happened that I could not hear her fetal kicks. As I'll relate more on mothers because they are the one who carry the pregnancy. Yeah? Most of the times we relate our growth, the baby's growth, when they are in there by the kicks, moves. But unfortunately, at around 7 months, my daughter stopped kicking, moving, so I had to go to the hospital. The unfortunate, I had another baby, little baby, who was 1 year and 4 months. So when I went to the hospital, the doctors thought, labda ni pressure niko nayo ya huyu mtoto mdogo, that is why maybe I'm overwhelmed. But ikabidi they admit me, and then they had to do some drips and to see whether my BP will go a bit high, the movement will improve, but it didn't. Unfortunately, instead of the kicks growing, they were dull. So, and that is how Nicolina was born.
At 7 months.
At 7 months.
Okay.
She was 2.4. That was good birth weight. So we were able to maintain her. She didn't go to the nursery. And unfortunate when nililetewa mtoto, she was so brown. Niliangalia nikashangaa kwa nini mtoto wangu ako na veins. Unaona veins all over. And then at the chest, you could see the mamaling. So I just was like, what is this? Kiangalia unaona roho kama inapigia nje. We called the pediatrician and akakuja akasema hii ni maumbile tu. So as the baby grows and vitu zita change. And I was discharged after the delivery. 4th day I came back because
to the hospital.
Yes, to the same hospital where I delivered. Because alifungana. Kukuja nikaambiwa mtoto amepata pneumonia and we were treated with the same notion. Hii ni maumbile. The same doctor said hii ni maumbile too. So don't worry. It did not click. Maumbile might be a disability. Maybe I thought hii ni kitu itakuja tu kwa muda, maybe sababu amezaliwa kama hajafikisha and ishe. But it repeated itself like that. After every 2 weeks, pneumonia. After every 2 weeks, pneumonia. But we had, as a parent, lazima ungangane. Otherwise, tunaamini daktari sana na venye amesema. And most of the time, as we run to them, we respect them. And as a CS mother, you don't have much. Yeah, so I had to follow up the clinics until where mtoto alifika, haongezi kilo. Every clinic you go, daktari ana complain, why is this baby not feeding well? And my baby did not belch until 2 years and a half. So they were saying maybe the baby is not feeding well, that is why her belch vizuri. So siku moja akafungana at around 1 year. And it was very bad attack. I was sent to Thika level 5 and we were sent for an X-ray.
Great.
Yes.
Perhaps just to make a little interpretation of that, because I know there's someone who will watch this story, ama who's watching this story, na hawezi elewa Kiingereza ama Kiswahili. Nyina wa Nicolina kana waboy. Agire Nicolina Mary Mogwaja in her pregnancy.
Yes.
Na they noticed kana makimenya akirealize we mwenyewe tamuciari uria mwana aciarwo ena thina. Aciarirwo not normally kawaida ta mwana uria ugi agi expect kana toria agite mwana wake wa mbere. Wakeri mwana wake especially atumia ni moyo wonoko ati mwana aria ahona nierurukaga. Mwana wake nderurukire until miaka ire.
Yeah.
Etiko.
Neguo. When we were sent for that X-ray, ikakuwa shida. Sababu daktari tulipomlaza kwa ile meza, alisema shikeni mtoto shingo na miguu. Because at her side, he could see mtoto ako na curve kwa spine. We remember, tumetuma tuende X-ray ya chest because mtoto anafungana.
At what age?
At 1 year and a half.
Okay.
And when we went, daktari mwenye tulipata radiologist, badala atuambie kuhusu chest, anatuambia kuhusu mgongo. And I told the doctor, we are here for a chest X-ray. Kaniambia, yes, I know we are here for chest X-ray, but kuna kitu naona ambao nataka kuhakikisha kama ni ukweli. And we did as what he requested us to do. Unfortunately or fortunately, that was our starting of why we are here. Mtoto wangu nikaambiwa kuna curvature kwa spine ya 28 degrees. The chest was okay, but the curvature ilikuwa imeanza kupress the lungs. So that is why every time we block, we are having an issue with the lungs. And the long journey started. We were told to go to Kijabi Hospital. And I took that as a parent. Ukigundua kitu iko haiendi vile iko, inabidi uchukue hatua nyingine. And I was sent for that referral at Kijabi Cure. The reason why they sent us to Kijabi Cure, it's because of the spine curvature. And also we were given drugs za kwenda za treat pneumonia, which was there. And when I went to Cure, they sent me to Kijabi Hospital Main. The reason why, the doctor in Cure realized, yes, the baby have an infection, the baby have a curvature, but this baby have another heart condition. I think Gikuyu ni gikuiguika wega. Rĩrĩa ndakinyire Kijabi ngĩkora mwana nĩma curvature iho, pneumonia iho, na nĩ nderwe na thĩna wa ngoro. Kijabi matiarĩ na ndagĩtarĩ wa ngoro. Kwĩ ndagĩtarĩ uma Nairobi agoka. Koguo no either nyingĩre clinic-inĩ ya ndagĩtarĩ kana ngethe ndagĩtarĩ ũcio kũrĩa umaga. Nao Kijabi Cure makĩnjĩra nĩ makũhe ka jacket ga kuoha mwana nĩgetha mũgongo ũtige gwĩkũnja. Na rĩrĩa ndathire ngĩrwo ũhoro wa ngoro, I think hau nĩho ũritũ ũrĩa mũnene wanyingĩrĩire. Ngĩriganĩrwo nĩ pneumonia, ngĩriganĩrwo nĩ mũgongo gwĩkũnja, ngĩingĩra kesi-inĩ ya ngoro tondũ o ta ũrĩa tũĩ kesi cia ngoro itikoragwo ihũthũ. And ngĩambĩrĩria rũgendo ngĩũka Nairobi, ngĩetha ndagĩtarĩ wa ngoro, na ndamũkora agĩtũrorera agĩtwĩra ngoro ya mwana nĩ nene, veins ciake atarĩ ĩrĩa nene ĩrĩa ĩrutaga thakame kuma ngoro gũtwara part ingĩ cia mwĩrĩ, onayo nĩ nenehete, na valve ciake 4 nĩ ikuĩte. But there is hope. Na kĩnjĩra mwana ũyũ ara suspect ena condition ĩtagwo Marfan's syndrome. Ĩrĩa ĩkoretwo ĩgĩtũmi kĩene kĩa mwana ũyũ gũtũra akĩrwo ena pneumonia, gĩtũmi kĩrĩa gĩatũma mũgongo ũcio wake wambe gwĩkũnja na thĩna wa ngoro. Na agĩtũhe treatment plan, agĩtwĩra mwana ambie kũnyua dawa. Unfortunately, tũtingĩa affordire dawa ya maĩ. Koguo mwana mwaka ũmwe na nuthu ambirie kũnyua dawa ya tablet. And nĩ harĩ haritũ. Biũ ũndũ warigagwo seriously nĩ tũkũhota. Mwana hĩndĩ ĩyo week ndarongerera kiro, ũrambato kiro, ũkambato kũrwaria mwana, no wambato kesi ingĩ cioka. But I'm so grateful tondũ ndagĩtarĩ nĩ aheire a good counseling na kĩnjĩra rũgendo rũrũ you will make it despite nĩ ũkorwo na irũngo nyingĩ cia treatment na kuona ndagĩtarĩ tofauti, tondũ thĩna ũyũ twa discover ũmũthĩ ona maitho nĩ affectete, rũciũ ũkĩra ũthiĩ kwĩ ndagĩtarĩ wa maitho. Can you imagine ũgũkĩte wĩcirĩtie thĩna waku no wa nyiha, wakora nĩ wongerereka. Na kwĩra to ndagĩtarĩ wa maitho ũcoke ũthiĩ ũgethe ndagĩtarĩ wa mahũri, tondũ condition ĩno ndĩra suspect ĩhutagia maitho, mahũri, nda na mũgongo. Unfortunate ciothe nĩ ciahutĩtie mwana wakwa at that 1.5 to 2 years.
Good people, ndio nĩ ũndũ ũrĩkũ wanagĩrĩra mũtũrĩre-inĩ waku, kana ũgathiĩ through ũkaga ũndũ ũngĩra Ngai, ũndũ ũngĩũria Ngai, ũndũ ũngĩũria mũndũ, ũndũ ũngĩũria ndagĩtarĩ at 1.5 years, right?
Yes.
And so how has the journey been? 9 years. After no discover macio mothe ni watũmwo kwĩ ndagĩtarĩ wa maitho, ndagĩtarĩ wa mahũri, and just to tell you akĩrwo ũhoro wa ndagĩtarĩ wa mahũri, hau niho pneumonia yonekagĩra maita maingĩ. Now when she talks about curvature, ni spine gũkorwo ĩgonyete, ĩgakorwo nĩ ĩratindĩka gĩthũri.
Yes.
Na mahũri. Then Nicolina gĩkorwo ena thĩna wa ngoro.
Yeah.
Ngoro gũkorwo ĩkĩneneha na mĩkiha gũkorwo ĩkĩimba. Then I discovered thĩna wa maitho. And so how has the journey been? 9 years. After no discover macio mothe ni watũmwo kwĩ ndagĩtarĩ wa maitho, ndagĩtarĩ wa mahũri, and just to tell you akĩrwo ũhoro wa ndagĩtarĩ wa mahũri, hau niho pneumonia yonekagĩra maita maingĩ. Now when she talks about curvature, ni spine gũkorwo ĩgonyete, ĩgakorwo nĩ ĩratindĩka gĩthũri.
Yes.
Na mahũri. Then Nicolina gĩkorwo ena thĩna wa ngoro.
Yeah.
Ngoro gũkorwo ĩkĩneneha na mĩkiha gũkorwo ĩkĩimba. Then I discovered thĩna wa maitho. So Mama Nicolina.
Yes.
9.5 years later, how has the journey been?
So rukoretwo rwi rugano ruritu ukagia arata makiuraga ugatengera to an extent andu makona ato pretendagi attacks cia mwana gakinya handu ndarahota kuria mwana ko ndamuheaga irio iria twiragwo tuhe na giciko kindu gabakuri ndaninaga iciko 5-6 na wamuhe makiria hau cikouma wathie kwi ndagitari agakwira agakuhe supplement tukamuhe supplement gutire kiro irongerera igikinya handu ngimera I think ni nguthie gwe cardiologist to no ndonire the safest person uria wanjira uma wohoro no uria wandeithia uria nguthie na mbere na rugendo ruru na ni twathire kijabi miakena unfortunately twathiete na curvature ya 28 tumire kijabi na curvature ya 94 after 4 years
as the girl is growing
as the child grows no ne mamwikirire brace mamwikira pressure kiambata makiuga ndage kirwo ni undu wa thina wa ngoro nekire magukunjika ati kugeria kurungika ugweri tugikara na cardiologist daitara wa ngoro makindo makinyata twathi kinyata tukiro situation ya Nicolina ndirio ndungi gwika no ithire ja nitwakoretwo ta muciari nduikaraga ukiroraga opinion nyingi nitwathiete thibitari itago BSL na makageria gututhondekera mwana. I salute Dr. Wanyoike ni undu uria njikeire tondu nia tuikaririe thi rikana twakuanaga ta family tondu uria kuigua uria ungi ucio kuigua turore tuone alternative imwe muciari ni athiage so disappointed na I'll tell my friends and fellow parents, please, when a disaster come in your family, mutikana tige mundu athie thibitari eiki.
I'm just thinking, this journey, more than 4 years, is an expensive journey, very expensive. How have you managed?
There before, nidari na mawira. Na ne matuteithagia muno to facilitate. My parents, my father, unfortunately, I lost my dad about 3 months ago. They have supported us. No ni gwakinyire handu tutiri besha. And we went to friends na tukifanga fundraise ire yatuhotithirie riria twandikirwo guthie thibitari nja. Tugika na tugithie thibitari bururi wa India. Dioi igiuga atia. Sometimes ndeciragia thabari no ndathiete ya miaka 7 yari the hardest. But thabari iria ndathire ya mieri 2 yari nditu gukira miaka 7
in India.
In India. Tondu ndathire India na mwana gitiga kaka gakuru. Ndathie na mwana deiki githie face the treatment journey. Yes, I was ready for it, but I didn't know it is as hard as it was. Mwanake roro test ciothe mage confirm mwana to Marfan's syndrome nayo ena condition nyingi etagwo malphanoid progeroid lipodystrophy iria iratuma ati nginya mwiri wake ndura absorb fats nikyo mwana wakwa atarongerera kilo nikyo mwana wakwa atarakorwo agikura like a normal child nikyo gitumite agie na skin na kamwiriga very skinny tondu wa these two conditions. And conditions they inherited. It was a cause of a gene between me and the father. So a gene just decided I'm not going to form normally, and it just elapsed. But I'm so grateful as I say this. Nini darira miaka 7. Daniel, it is very hard to see me at this point. One gerera. ndariraga ngigeria kurora thina wa mwana wakwa niki. We went back to the family, both families. We went to our parents, dig out kana kwakwa na koro. Ugakinya ugakorwo ni andu magakwira tuthie kanitha na, but ndire ndawiva. I'm a Catholic. No ndire ndawiva witikio-ini wakwa. Tondu what I know, Ngai akoragwo hamwe na Mwathani akimenya gutuhe mwana uyu aheanite na gitumi. He knew I will be able to handle it. So nitwake ethire o uteithio kuri ukuhota kuma, tuke decide mwana uyu athie India, maundu mahota kwagira. But ndeciritie ndathie surgery ria gukorwo ya mwisho. No riria gwatu confirmirwo riu ici ni case igire gwatwikire mwana uyu no ekirirwo cuma mugongo iria irigucagio after every 9 to 1 year. 9 months to 1 year. And repeatedly, we went in India 2021 and 2022 for the same procedure. We are looking for money to go for the 4th time. So the condition ya Nicolina, it's progressive. Stage ni yake ya gukura na tutigiria mwana uyu akure. Ngai amurutite kuria kururu kuria tutoi niki kiramugia kuria gia maundu tukarigwo kana umutigire ndagitari kana umutige thibitari ure tugoka kumenya ni atia agikirwo. That is why I no longer cry. Ugikanyo na ngirira menya he mundu uhutitie handu.
What a great faith. And I think when the Bible says that faith comes by hearing and hearing the word of God, I think even by seeing things strengthen your faith. And dikire muine na ndiri muini wa nyimbo cia ndase kana cia mataro. No he muini Joe waini ria kiuga ati ndari ama no nyina wa mundu. There is only a mother utangitiganiria mwana wake.
That is true.
And at very many occasions we've seen parents who've left their children. Musiria gokira akona nie this case I can't.
Daniel, never judge them.
Yes.
Never judge them. And I will repeat again. Ona mugikaigwa mundu ni atete mwana kana ni amutigite. Don't call them bad parents. Ask us, we will tell you.
Wow. Good people. Tukiambia demoirire gutiri convoy ya gari imwe. The reason for saying this, umuthi ni Mama Nicolina within a mwana wake. Tomorrow it might be me.
Yeah.
In a whole different version. And as Kenyans, as it has been known that Kenyans, we are a family.
Yeah.
Are people who walk with one another. Kana modo utatikanagiria modo wa ithe. Kana modo wa nyina. And so we are here with Mama Nicolina. And of course we have Nicolina with us.
Daniel, let me, I think, do a recap.
Yes.
Gerera Nicolina, my firstborn akinya miaka 5, niambirie kugia na thina tutangia noticire. Either eragerie iki tukona tari a normal thing. Dirikana we are overwhelmed ni kesi ya mwana uyu.
Yes.
But I salute one girl etagwo wa Boitani. Akirire akijira mwana uyu riri ari mwakago wa nyumba eno kana mukore ingirite mai-ini, you will blame me. Mwana wakwa ambirie kugia Jesus kuinainaga kana ore mwikarite handu agatengera ore mwagathie akinya handu agakuria kwa nini ujanifuata, akidevelop thina akiambia gwithugumagira na ni mwana munene utathugumaga muthenya. Hindio mwana ni ingirire thukuru na ikibidi ndimutwarire the same cardiologist. Ni ndageire na mundu ungi wiho andeithirie, ndathia njirire ino ni case ya neurologist. Gitwara kana kau gakuru na ngiro kena Jesus ni ta epilepsy, which is a bit abnormal. Na tugithie through another hard process. Put in mind when kana kena condition where on a lifetime.
Yeah.
Another one have elapsed. It was hard. I think kiriro giakwa giakinyeire mwisho hau ndarira mieri iria ndaririre maitho makwa madry hau maithori.
Wow.
Yeah.
How is your firstborn girl?
My firstborn girl is 13. She's doing fine from 6 years to now 13. Anyua dawa cia epilepsy. Epilepsy ni gifafa.
Yeah.
We are grateful to people aria makoretwo magituteithia tondu thabari no ndikoretwo ihundu financially. Ndariaga dawa. Anyua dawa ithathatu muthenya. Na ti cia mbeca nini. Mweri umwe anyua dawa cia 18,000. But there are people who are behind gututeithia and making it happen. Riria ma realize there is a chronic and there is a rare disease na niguoka another issue, they came through. I'm so grateful to God, to friends who are genuine friends who came through when was happened. Thank you.
May God bless them so much. I think we can say with confidence, Gayaro Maradima. Whoever they are, wherever they are, Gayaro Maradima. Something here. It's written about Nicolina. Nicolina needs at least, and I said, allow me to say at least,
Yeah.
2 million.
Yes.
Because it may be needed more than 2 million.
It will be needed more than 2 million.
Yes.
Because this is a continuational treatment. Twathie surgery no ya kana tugukorwo tutigitie surgery ingi ithatu. Tondu Nicolina arabatara kugucio cumeo ithiini, I'll demonstrate ni gukuonia na egucio nitumegucitie maita matatu. Yagucio ria kana ikurutwo ikirwengi nigetha mo push the next 3 surgeries. Na kia korwo akura atige gukura ringi riu ekirwa permanent rod.
Okay.
Iria kuhota kurunga mugongo. Twambie treatment riu ya ngoro. Koguo Nicolina arabatara gukorwo na continuous funds. No njukite ni undu wa kuhoya mbeca cia kuhota kumutwara treatment ino ya kana. Na kungigia mundu ungehota kumuhe continuous support, he or she, you're welcome.
Agiriru guthie India ri.
Twagirirwo gukorwo India mweri wa 2 this year. Unfortunate, my dad thenio ni mwiri muno na ikibid. I'm the firstborn in the family. Utiari undu ungi. I was the dad's girl. Dageria ku balance all the way. My dad was more critical. Utiari mbeca. Ndambirie gwetha mbeca cia Nicolina mweri wa 2 na itire ciaigana. Koguo Nicolina agirirwo gukorwo agithie treatment lately December thira.
We are 9 months late.
We are 9 months late.
And this girl needs to be in India. And from this, we need 2 million at least for Nicolina to go to India. You have a pay bill.
It's okay.
And the pay bill area we are using to work with Nicolina, 8043261. 8043261. And the account name, account name Nicolina Njeri Medical Fund. Nicolina Njeri Medical Fund.
Yeah.
Good. Hey Nicolina Kameme. Hey Njeri.
Hi.
How are you?
Fine.
Tell us your name.
My name is Nicolina Njeri.
Nicolina Njeri.
Yes.
How old are you?
I'm going to 12.
You're going to 12.
Yes.
So you're in school?
Yes.
Yeah. You in grade
4.
Grade 4. Aya, sawa sawa. Tell us something about yourself. Yeah, about your health, kindly.
My health is not that much good. At night, I can't sleep the way you sleep. I sleep different. I can turn this side, and even the back. And when I eat, I don't eat that much. When I eat, my stomach will hurt so much. I feel so pain when I can't sleep.
Okay.
Nicolina ndangĩhota gũikarĩra gĩtĩ kĩa mbaũ for a long time. Ndangĩhota gũikarĩra a plastic chair for a long time. Nicolina nĩ athiaga thukuru, no yambindire ndĩmũthondekithĩria special chair. Ona gĩtĩ-inĩ kĩu, sitting for a long time,
It's a problem.
it's a problem. One, ndarĩ na muscle ta ĩrĩa ĩna mwana wa rika rĩake. Koguo nĩ akũnoga na ihenya. Ena curve mũgongo. Koguo nĩ ra disposition hip yake. Koguo ndangĩhota gũkorwo agĩka maũndũ nomo. Rĩmwe nĩ akiraga akanjũria, ngahota gũikara ta ciana iria ingĩ rĩ? Ngahota gũthaka mathaa maingĩ na ciana iria ingĩ rĩ? But ndĩmwĩraga ihinda rĩa Ngai rĩakinya, God will make it happen.
Great. Yeah. Mama Nicolina, Winnie Wamboi, looking at this camera, talk to Kenyans. Talk to people of goodwill.
My good friends, Kenyans, ndoka haha ta mũciari wa Nicolina Njeri, ngĩhoya ũteithio nĩ ũndũ wa Njeri. Njeri nĩ akoretwo na thĩna ũrĩa wamwambirie kuma mũnini nginya haha tũrĩ. Nĩ aratũbatara, niĩ ndĩ ta mamu wao, we wĩ ta Mũkenya, we wĩ ta well wisher, ũke nĩgetha ũmũteithie ahote gũthiĩ na mbere na normal life. Ũngĩmũsupport na ciringi yaku, nĩ gũteithia Nicolina athiĩ agathondekwo spine. She's a brave girl, I can attest and testify that. Going through 3 surgeries, imekuwa ngumu. She has made it. Hata sahi, tukimsaidia na ile kidogo tuko nayo. Please, I'm coming here as a mother, as a caregiver. Help Nicolina. Na rĩrĩa rĩothe wacamania na mbica yakwa, tiga kũnyonaga niĩ ta Winnie, onaga Nicolina. Nicolina does not have friends like angĩhota gũthiĩ kwĩhoera. Nicolina ndangĩhota gũkĩra oke kũrĩ a politician, oke kũrĩ kanitha cianyu. But me as a mother, I'm bravely requesting and appealing for your help towards Nicolina's health. God bless you as you purpose to help Nicolina and assist her to go through her 4th surgery. Thank you.
And dear Kenyans, as we call it off today, and as we talk about Nicolina, I just want to remind us, and this is a mother talking to us. It's a mother talking to us about her own children. Perhaps no ugedoro wagia mwana, no ni ukagia. Perhaps no ugedoro wagerera hado harito, but who knows better than God? Ihoya rito, na wendi wito, it is to see Nicolina goes through her 4th surgery and coming out victorious. It is our prayer. And I know a time will come and you will say, together with Nicolina, I made it through, but I don't know how I did it. I made it through, I don't know how I did it. But Jehovah did it for us. Nicolina Njeri needs at least 2 million Kenyan shillings to help her go to India and to undergo her 4th surgery. And I say this in Kikuyu. Nicolina Njeri arafatara at least shiringi milioni 2. Now just to remind you, Emieri keda late agiriri gukorwo athiete India mweri wa keri kana February ya mwaka uyu. No ni undu wa maundu matangiagirikire megie again health issues in the family yari more critical itagietereire. It had to let her wait until now. Just to remind us, Nicolina is 9 months late to go to India, and she must, and she's needed, and she's required to be in India before December of this year. Good people, dear Kenyans, the hand that giveth, receiveth. It is better to give than to receive. It is our appeal, together with her family. She may not talk much about herself. She may not be able to speak the whole thing herself. But it is an appeal. Let's help Nicolina ease her pain. Let's walk her journey. And the paybill number is 8043261. 8043261. Account, or rather account number, it's her name, Nicolina Njeri Medical Fund. I repeat again, 8043261. Account number, Nicolina Njeri Medical Fund. A recap of the whole story, because we need to let this girl leave the set. She's having a multiple congenital disorders. How I wish kiria Ngai agukurathima nakio just to walk her journey. Support Nicolina ease her pain.
Thank you very much for giving us this platform. I will just show her back how it is presently. Nigetha andu maerewe kavino turauga niki. Ungimurora ikarite no one ta araikara na mwena. Andu no morie niki ciande citaraiganana. Nima kuhota kuona ona waist level yake ndiraiganana.
Okay.
May the well-wishers come through and ease Nicolina's pain. It's painful watching your child going through pain. It's very painful. Ukimenyaga ati ndagiukira akeethere. Ithuothe ta ciari tuthiaga gwetha umatho nigetha tuhote kurora ciana citu cikare wega. But it's still more painful riria health ya mwana waku at stake. May God bless everyone. Uria go come through ni undu wa Nicolina. Na ihoya riakwa kirio kuhanda Mwathani aromuhingira. Mirimu ti kwanyu tu na nginya family cianyu ciothe. It's painful. It's been a very hard year for me. I lost a father who went through a very hard time. I'm having a daughter with multiple disorder. I'm having another daughter with epilepsy. It's not easy. To all parents who are going through the same, trust God. Have faith that your day is coming. Dig yourself deep in church so that you can get spiritual support. Sometimes you'll be drained emotionally. Don't vent to people because not all shoulders you can cry on. But vent to Christ who comes even when you don't have a friend near you. God bless you. Ongirora ni ukuona Nicolina haha ni aroneka he handu atemetwo. Haha niho akoretwo akihingurwo maita macio athiete. Ria mbere cuma yaingiriirio rugongo na ria ingi kienda ikihingirwo gatagati. No maita maria macio mangi meri igucitio ihingirwo ha gatagati-ini. Koguo agirirwo guthie igucio ringi nigetha wimbo uyu uroka have ino iragia mwena uyu itige agie na mugongo uhana ta witu ugutwika straight. Hip yake tige kuimba mwena umwe nigetha ahote guikara na ahote guthaka tondu tariu kuria gwake ni kuritu kuhota guthaka ta na twana turia tungi ndangithaka ihinda inene nigetha acoke maisha make nomo. This is her back at this point. No yathondekwo ni gucoka